Okay, we're going to talk about cheek augmentation. It's a topic that unfortunately is a very favorite topic of most people, and it is not a very favorite topic of mine. The reason is that I think it's so overdone and it has become a stigma of bad plastic surgery or bad cosmetic facial enhancement. We see all these celebrities. Most recently, I think in the last month, I saw Ryan Gosling with these massive cheeks that just look absolutely crazy. The way to understand the cheek is that there are many ways to augment it, and the number one goal is not a cosmetic gain, it is an avoidance of a problem. So we're going to sort of anatomically divide the cheek into three components. The first component is the anterior cheek, the second component is the lateral cheek, and the third component is the buccal area. But I'll actually mention a fourth area along the sides of this is the subzygomatic space, and maybe the fifth area, the zygomatic area. Now, those are not really part of the cheek. The cheek is really the anterior, lateral, and the buccal area. So what are these other two components? They're transition zones. And those transition zones do have merit, and I'll talk to you more about that. So the number one problem right now with cheek augmentation is augmenting the anterior cheek. The anterior cheek, which is right here, looks bizarre. And I found that in the past when I used to put fat grafting into that area, it holds really well and it just doesn't look right over time. I've had to go back and actually suction the fat out of my patient's face that have done fat grafting with me maybe 15 years ago or so. It just looks weird. And I was not putting a lot in. And to tell you how little I put into the anterior cheek, I put about a milliliter or 1.5 milliliters in. 5 milliliters is a teaspoon. So it's an incredibly small amount of volume that still did not look right. And I also had put fillers in many years ago. Fortunately, I haven't done this for over a decade, and I've had to dissolve that. So basically for me, I'm very gun shy to put anything into the anterior cheek. Now, I hear a lot of people come and tell me, look, my anterior cheek is flattening. I don't like that. I can see a linear or line depression. I don't like the fact that this doesn't look full. I will tell you, leave it alone. And I've got minor methods of managing that area, and I'll talk to you about that as well. But it is not about volumizing. That's the area that doesn't look right. And when does it not look right? It's when you smile. So when you smile, things look off, and that's why you have to avoid that area like the plague. So how would I fix a small linear depression? First of all, we need to get rid of the idea that, hey, my cheek is flattening. I've heard this way too many times. Oh, my cheek is getting flat. You need to leave that flat and maybe even inverted. Now, if you've got a linear depression called a malar bag or malar ligament, that's a whole different video discussion, which I'm going to shoot too on malar bags. But if there's a linear depression in this area, I use a filler technique that I learned from a Dutch doctor where I'm actually leveling and bringing that line back up, that minor linear depression. When you try to correct the linear depression rather than adding volume, you manage that transition zone and you avoid augmenting the cheek. You do not want to augment that anterior cheek. So laterally is my favorite area. The lateral cheek, which is over the lateral bone, is an area that really augments quite well with volume, with fat, with fillers, you name whatever you want to do. I prefer fat if I'm going to do around the eyes. If you don't know this, I've migrated away from fillers around the eyes. I've seen some migration potential even 5 or 7 years later. And if you think, well, how could that be possible? I had hyaluronic acid supposed to go away in a year. They really don't. And so migration issues, if you look at celebrities, you look at Jennifer Aniston, things like that, you see that there's migration issues around the eyes. Unfortunately, I've seen it with my treatments as well. So I've really stayed away now from fillers around the eyes. I'm doing fat. So if someone just wants a little filler out here, they just want a little augmentation, no problem. I have not seen an issue with that in 20 years. But if I'm going to do fat here, I'm going to go and do fat on the sides. That way, the area, you're there anyways. You're paying for the fat, you're going through the procedure, and I can volumize it. Now, the lateral cheek, I want to take a step back. I probably should have presented this earlier. What is the concept of aging? The aging is seeing the cheekbone. And a lot of women tell me, hey, I like my cheekbones. And the cheekbone is actually something you don't want to see. Now, I know that when you go back in time, when I have women go back in time to about 20 years of age and they tell me, hey, I hated when my face was all fat, I couldn't even see my cheekbone as a big blob. I'm not trying to do that. Most women like a little bit of articulation of the visibility where that area starts to sink in a little bit and you can see a little definition. That's what I'm trying to achieve. But when there's too much definition and you can actually see the cheekbone stick out, that's when there's aging. And so when I can soften a transition around the outer area to soften that bone, it looks better. And so there's really two ways to soften bone. One, with volume. One is to actually put volume on the bone, which our brain has a perception of seeing something that is bony versus soft tissue. And so when I can give soft tissue augmentation, your brain no longer sees the bone. The second concept, and that's what brings into the concept of the two areas here, I call them watershed zones. If you think about how we age, the bone actually sticks out. And then you have a scalloping dip here and a scalloping dip here. A younger face may have those scallops, but those scallops are less abrupt and they're not bony. So whenever I fill this area with fillers or with fat, I like to add a little bit of volume on either side so the transition is less abrupt and you don't see this. Otherwise, you see the architecture there. And for someone, for example, that comes in with a very small budget, they're going to do fillers, they can't afford even more than one syringe or whatever it may be, and I can fit most budgets out there. I will sometimes not even deal with the cheek, and you can listen to a video or watch a video called Watershed Zones where I go through that in more detail, but I fill around the edges of that area so that that transition zone becomes less visible. Because when you see, how do you see bone? You see bone by seeing where the bone transitions to no bone or where there's a dip. So if I can augment the edge of the bone on both sides, I can create the illusion of bone coverage. So the lateral cheek with maybe some above and below subzygomatic and temporal blending will help a lot. It also helps architecturally when you're looking at a face, because a face has what is called I call it an egg or an upside down egg, or a triangle is probably even a great one because it's easier to understand. Like a triangle like this, okay, versus this, where the bottom part becomes bigger. Now when this becomes bigger, it's probably a facelift, maybe some micro liposuction, things like that to manage this area. Maybe in rare cases some Botox to manage it, but sometimes when you're 50 years old and you try to Botox and slim that, your jowl will actually look bigger. So it's not going to make the jowl bigger, it's just a relative size issue. So that's not always a good option. And so sometimes what happens is, you know, I'm a surgeon and a non-surgeon. I've really worked my whole life to craft excellence in both, and I really believe that, you know, if you're a great surgeon, you let someone else fill you, you're going to look ridiculous. If you're a great injector and you think everything can be solved through injection, it can't. You need surgery for certain things. And so when people come in for consultation, I walk them through that. It's not that you have to have a facelift, not that you have to have surgery, but I don't want to be doing silly things like Kybell in the neck that's only going to cause problems. That's a whole other video about that. But just these are conceptual problems when you're looking at things. The other place that I used to love, and I'm going to call it an extension of the cheek, which is really the buccal area. That's this hole, that's area. This is an area that people are in love with doing buccal fat removals. I don't do a lot of buccal fat removals. I do them in very select cases when I've got, usually it's an Asian, they're probably into their 30s and 40s and they've got a fuller lower face. That is a great candidate for a buccal fat. Where I think the problem is right now is you're taking buccal fat in 20-some-year-old white people, and they're going to have serious problems when they get to 40. The reason is there's no fat that's comparable to buccal fat. You cannot go and put more fat in there. I have looked at my results. Unfortunately, this is the benefit of being over 20 years in practice, is I look at my old results and I say, these have stood the test of time and these have not. And I will say that buccal fat enhancement or adding volume to this area can look odd because it's like a pit that never gets filled. You keep on putting fat in there or filler and you think, oh, it's never done, and then all of a sudden you smile and it looks like a big ball in your face. So this is an area that I used to love to fill. I don't love to fill anymore. So I would say this and this area leave alone. And what's interesting is my deep plane facelift actually brings volume back up to this area. So that combination of volumization is elevation can actually bring volume back to where it should be. The natural question in this video, if we're talking about cheek augmentation, is what about cheek implants? And categorically, I think it's a problematic procedure. I haven't done one in quite a while, and the reason is several-fold. The first is a colleague of mine out of California said he believes this procedure is actually fraught with complications and problems, and I agree with it because you have to go intraoral to place this, in other words, through the mouth, and there's about a 10% risk of infection. There can be migration issues with it. And the real problem, though, is long-term. If you do this in your 20s and you think, I love it for 10 years, over time, as that volume starts to dissipate, you actually have an exacerbation of that cheek mount, and it doesn't look right because now you have this bony contour and everything is faded away from it, and it just stands in isolation, and you actually look older, and you may actually look unnatural. So I have moved away from cheek implants. Now, in contrast, I love chin implants. In fact, I don't think soft tissue can fix this. So for example, if someone's got a small chin, then you can put fat in there. It's going to look like a big fat chin, and it won't look like natural projection. You need a chin implant to do that, and the chin implants really don't have complication rates like cheek implants. So chin implants and cheek implants are quite different. And so when you're trying to augment bone, looks amazing. When you're trying to augment cheeks with bone, I think it's a problem. I think it looks odd. So, if it doesn't look odd initially, over 10 to 20 years, it will look odd. And I will tell you the one thing that's very interesting is that a lot of people say, well, I don't care what it looks like, what I look like in 10 years. I'm single now, I'm trying to date, I want to look good. Now, so long as it lasts for 10 years, I can just take out the implant. That is true. That is true, especially if you use silicone. So the one thing I'll tell you is if you're going to do an implant in your cheekbone area, don't use MedPore, Gore-Tex. First of all, Gore-Tex compresses, but MedPore is near impossible to get out. At least silicone can be removed, and relatively easily, and especially if you don't try to anchor it with screws and other things, then it can, in screws you can actually remove as well, but you want to be able to easily remove the implant. So I'm not in favor of cheek implants, but if you've got to do it, have one that can be removed more easily. But the other thing we don't think about is in 10 years from now, people, I always say the definition of old is basically 10 years older than you are. So for example, if you, like I'm 55 right now. At one point I thought 55 was very old, but that was 10 years ago. At one point I thought 45 was old, and that was when I was 35. My parents are in their 80s, and I will tell you they think 80-some-year-old is really young. 95 is old. But this is the relative problem. We don't have a vision of where we're going to be in 10 years. I'm doing this entrepreneur group meeting retreat next week in Boston, and our exercise is to envision where we're going to be in 10 years. And part of my exercise that I said is I don't know what I'm going to be in 10 years. We have this grand vision of where things are now. We always should set visions of where we're going to be, but we oftentimes have no ability to understand where we are in 10 years. I could not believe 10 years ago I would be married with kids, with a home in this place, with my business, the way that I've developed new techniques for Botox therapies. These are really cool things that I have no way I can have conceptualized 10 years ago. So my point of this, small digression, is that I'm here to protect you against yourself. You think, oh, it doesn't matter what's going to happen in 10 years. It absolutely does. I have to make sure you're okay. So for example, when I do hair transplants, people say, I don't care what I'm going to look like in 10 years. They have a disaster in 10 years that can't be fixed. That's a problem. You're going to still live, hopefully, on the earth for another 20, 30, 50 years. I have to protect you against your own decisions. So whenever you make a judgment of a choice today, even if you don't care what you look like in 10 years, because now you're single or you just got divorced and you just want to look good for the next few years, I have to protect you against your own thoughts of yourself. And I have to think about those elements when I'm making some choices. So hopefully this video about cheek augmentation wasn't too digressionary or too difficult to follow, because there are many ways to do things, but it really boils down to one thing. Beyond technique and concepts, it's artistry. You can give someone the perfect implant or the perfect amount of fat, or you can tell them put in this amount. But if you don't have the eye for beauty, you're going to create results that just don't look right. I'm an artist in my core. I paint every single day. I've designed my logos for the building for my practice. I've done all the paintings for my practice. I've done all the illustrations for my textbook as well, not for some of them, but a lot of them I've done. And my whole life is predicated on thought of design. So I hope you choose me as a surgeon or as an injector, because I do all of it myself. I don't relegate or delegate this to anyone else, because I think that's where a huge part of the problem is you cannot delegate this to someone else who does not have the skill sets and, more importantly, the artistic vision to help you out.